Hi, I'm Sarah Bernstein. I'm a clinical nurse specialist in gynecologic oncology, and I'm here to talk to you about some of the side effects that you might be experiencing when you receive chemotherapy. So this is the one that we hear a lot about with nausea and vomiting. And let me assure you that I've been doing this for about 27 years. Chemotherapy hasn't changed a whole lot, but the medicines we have to support you and to make sure you do well, they've changed dramatically. And it's just not like the movies. It's always in the movies where everybody is throwing up, losing, tons of weight, everybody's bald, and they all look terrible. And the reality is that people actually do fairly well on chemotherapy. Let's talk about what is nausea and vomiting and what does that mean. We talk about acute nausea, which happens right away. We think about medications like cisplatin that can cause that. When we talk about delayed nausea, that can happen 1 to 4 days after you've received the drug. You're already at home. Carboplatin is one that can do that. We also have something called anticipatory nausea. Now this happens after you've received a cycle or 2 of chemotherapy. If your nausea is not well controlled, or you were unable to take the medications that were prescribed, or for whatever reason you got nauseous or you vomited when you received your chemotherapy, that can kind of set up a relay system in your brain that can then be triggered by sights, sounds, memories. If you think about when you were in the hospital and they bring in the food trays and you pull off the lid, how awful the food tends to smell. So things like that are things that can set you off even though you aren't necessarily right in the middle of chemotherapy. So we do our best to control nausea and vomiting, the acute and or the delayed nausea, by making sure that never happens, that you don't end up with anticipatory nausea. How often does it happen? Well, it's different depending on which chemotherapy we're talking about. Not every drug causes nausea. For example, Taxol is very well tolerated and is not known to cause nausea. That doesn't mean you won't get nauseous, but in general, there are medications that are known to be more emetogenic than others. We have these new medications that we use. They're both IV and oral. And one of the things that would be important to let your doctor and your nurse know is, are you someone who gets motion sick? Do you have problems doing the rides? Or if you sit in the back seat of the car? Because that can change how you do with nausea. So if you get nauseous and you're vomiting, what kind of complications can happen? Well, first of all, you're going to feel miserable and get anxious, but it can also interfere with your treatment. And we want to make sure that you do as well as possible so that we can keep you on time. If you get dehydrated, that makes all other symptoms worse. And also, if you become real dehydrated, then that can increase the electrolyte imbalances, things like magnesium and potassium. Those numbers can get low, and then we have to replace those as well. So also, if you're nauseous, you're not going to necessarily feel like eating, so then that can add to weight loss and just making you feel more weak and fatigued. So nausea and vomiting is something that's we're very cognizant of and try very hard to make sure you do well. So what can we do to keep you from feeling nauseous? And certainly I don't want you to ever have to throw up. There's nothing more awful than having to throw up. So we have medicine that we're going to give you at the time of your chemotherapy, and then we have medicine that we'll send you home with, so that just in case you don't feel well, you've got something there and you don't have to run out to the drugstore for that. Now, people always ask me, what can I eat when I don't feel well? If you've ever been pregnant, then the foods that you ate when you were pregnant can also apply here. Foods that are low in fat. We tend to eat more carbohydrates, so keeping things on hand like crackers and Cheerios, and keeping at your bedside. So if you don't, when you wake up in the middle of the night, if you're feeling kind of empty or nauseous, sometimes that's enough to settle your stomach. Low acidity, so you have to be careful with eating too much fruit or too much fruit juice. Those can add to feeling some nausea. And then finger foods that are cool or cold, those foods tend to taste better, like cold cheese cubes, small finger sandwiches that you've got ready to go. This is a good time to let others cook for you. So standing around the stove and smelling certain foods all day long, that can add to nausea as well. So you want to kind of stay away from foods that are highly odoriferous or fragrant. They can kind of turn you off. You may find that there are foods that you love normally that now, while you're on chemotherapy, you can't stand the sight of. So things like coffee and chocolate. I've had patients tell me that if there's foods that they love, they eat them all the time, and there are other people who say they put them away and wait till they're done their chemotherapy so that they don't lose the taste for those particular foods. Then the other things that can also add to nausea are things like sinus congestion and sinus drainage, or if you're getting very constipated, that can also make you nauseous. So keeping those in line, those will help as well. So it's important to take the medication that's prescribed on a schedule for 48 to 72 hours, and that's to avoid any delayed nausea that could occur. You may say, hey, I feel fine. I just don't want you to find out that you don't feel fine 2 or 3 days after you've received your chemo. It's important that you let your team know if you have nausea or vomiting, especially if it's lasted for longer than 24 hours, or if you're unable to maintain oral fluid intake. If you can't drink, then you're going to get dehydrated and you're going to start feeling worse. So we have lots of ways that we can help you, including medications, biofeedback, relaxation, sometimes bringing you in and giving you some IV fluids enough to turn things around. But the only way we're going to be able to do that is to find out how you're feeling and for you to call us. So uncontrolled nausea and or vomiting can be due to a lot of reasons, and it's important for you to let us know so that we can make sure that you're okay and try to fix it. So hopefully you won't know anything about nausea or vomiting throughout your entire trajectory of chemotherapy. But if you do have an issue, please call your oncology nurse or your physician so that we can give you a hand.